Testosterone. Testosterone is a staple for bodybuilders as it is the most popular steroid for a good reason. It helps increase strength and muscle. This is literally you injecting the very hormone that makes you jacked. It's the go-to for serious athletes when bulking or cutting. It has both oral and injection like enanthate and cypionate, and doses typically taken for 8 to 12 weeks at 300 to 1000 milligrams per week, improving your strength, recovery, and energy. However, side effects include acne, aggression, and given enough time can cause liver and heart damage. Plus, it suppresses your natural testosterone production, which basically means your balls will atrophy, aka hypergonadism, during which your brain fails to tell testes to produce testosterone, and if not dealt with, it's permanent. So you need to get post-cycle therapy, PCT, during which you have to stop taking steroids or even take medication like SERMs to restore your natural testosterone production. Anavar. Anavar is a game changer for bodybuilders who are cutting. This is what they use to get a lean physique without gaining bulk. It's also known as oxandrolone and is mild as its anabolic to androgenic ratio is very high, up to 10 to 1, up to 6 times more anabolic effects compared to testosterone with minimal androgenic effects. Due to that, it boosts muscle gain without acne or hair loss, and it helps lose fat and keep muscle on without having the bloated look, making it very good for cutting and having that defined and hard look. Plus, since it doesn't aromatize, it doesn't cause water retention or gyno. Medical doses range from 2.5 to 20 milligrams per day, while bodybuilders take 25 to 100 milligrams per day. But Anavar in the long term will cause liver toxicity since it's 17 alpha alkylated and passes through the liver, but the liver can't break down and instead accumulates and causes toxicity. It can also cause natural testosterone production to shut down, so you need to do PCT. Trenbolone. Tren pushes muscle growth to the extreme with fast results regardless of if you're cutting or bulking. That is because it has an anabolic to androgen ratio of 5 to 5, which makes it 5 times better than testosterone in building muscle, but also causes just as many androgenic effects on the body, so expect hair loss and acne. It's taken in injectable forms like trenbolone, acetate, and enanthate for 8 to 12 weeks at 200 to 600 milligrams per week. Even though it speeds up your gains, it can cause insomnia, night sweats, high blood pressure, since it raises red blood cell count a lot. And because of this huge risk, only pros use it to push their bodies to the extreme. Anadrol. It is best for chasing size and bulk, since it has an anabolic to androgenic ratio of 320 to 45, making it 3 times more anabolic than testosterone with half the androgenic potency. It is known as oxymethylone and is primarily an oral steroid for bodybuilders in their bulking stage to get bulk up fast. It's typically taken in doses of 25 to 100 milligrams per day for 4 to 6 weeks. And while Anadrol doesn't aromatize into estrogen, it still causes estrogen-like symptoms such as water retention and gyno. Plus, liver toxicity is a big risk, since like Anavar, it is 17 alpha alkylated, and it can also cause some androgenic side effects like acne, oily skin, and baldness in some people. PCT should not be skipped since Anadrol suppresses natural testosterone. It is also illegal in many countries for recreational use. Plus, it's expensive and stacked with testosterone enanthate for maintaining stable testosterone levels and decadurabolin to reduce joint pain. Dianabol. This steroid is famous due to classical bodybuilders like Arnold. It's also known by its scientific name of metandianone. Bodybuilders used it to get explosive gains in performance and muscle within weeks. It's usually used at the start of bulking cycles, and with a half-life of 3 to 5 hours, it works fast. But like all steroids, it has downsides. Water retention, mood swings, and acne are some short-term ones, and in long-term potential liver damage if PCT is not done. Plus, since it aromatizes into estrogen, it can cause gyno. Dianabol is no longer produced in the US after it was outlawed in 1990 under the Anabolic Steroids Control Act and subsequently in other developed countries. It's still produced in countries where laws are weaker, so it's abused a lot, especially when it's cheaper than Anadrol. Athletes also take it with testosterone enanthate to keep testosterone stable when taking D-bol orally. PCT is crucial since even 15 milligrams of it per day for 2 months can reduce natural testosterone by 69%. Winstrol, this one just like Anavar burns fat and keeps muscles lean. It's also known as stanozolol, and just like Anavar has limited androgenic effects, so it's good for cutting. It's available in injection and oral both, with injection doses around 50 milligrams per 2 days for 4 to 6 weeks and oral for 25 to 50 milligrams per day. But oral is more damaging to the liver since it cannot directly bypass the liver and causes toxicity. Winstrol raises strength, muscle hardness, and vascularity as it has an anabolic to androgen ratio of 30 to 1 and is a DHT derivative, making it really good for muscle growth. But like everything else, its side effects include joint pain, acne, and hair loss are common side effects. Long-term use leads to liver toxicity, cardiovascular issues, and suppressed testosterone. Winstrol was banned in 1974 by the IAAF, but the drug itself gained widespread attention in 1988 when Canadian sprinter Ben Johnson was tested positive for it at the Seoul Olympics. Decadurabolin. It's a very versatile steroid as it not only helps gain muscle without fat gain, but also improves joint health, allowing bodybuilders to lift heavier. Plus, its ratio is 11 to 1, so that's up to 3 to 5 times more potent than testosterone propionate. Decadurabolin is only available in injection form and dosed at 200 to 600 milligrams per week, with cycles lasting between 10 and 12 weeks. Its long half-life of 6 to 12 days means users don't have to dose too often. Plus, it allows you to bulk without water retention. Its side effects include acne, mood swings, and an inability to get an erection. Yeah, anyways, just like others, PCT is crucial, and long-term usage leads to liver and heart damage. DECA is also banned by all major professional and amateur sports organizations, as well as countries like the US and Saudi Arabia, but it remains popular. Bodybuilders also combine it with TRT for balancing testosterone levels. Clenbuterol. Clen is another powerful fat burner used by bodybuilders and used to kick the nervous system in gear by mimicking adrenaline and ephedrine, which target the sympathetic nervous system to boost metabolism and mostly used in cutting stages. Clen raises your core body temperature and metabolic rate, aka thermogenesis. Usually 20 to 120 milligrams is taken a day, and dose is increased slowly to reduce side effects. And since it plays with the nervous system, some side effects include shaking, faster heartbeat, anxiety, and trouble sleeping. Misuse can damage the heart's blood vessels, leading to palpitations. Clen is banned, and its long-term safety risks are pretty unknown. PCT isn't always needed, but you have to manage side effects. That's the important part. Halotestin. Unlike Trenbolone, halotestin makes you into a ball of rage rather than anxious. It's also known as fluoxymesterone. This is like an FDA-approved DHT, and sometimes prescribed to teenagers with delayed puberty. And since it's very sensitive medically, it is only taken for 2 to 3 weeks maximum, while bodybuilders use it a week before competition as it makes them look grainy and hard. And even fighters use it a lot, since the aggression from it makes them train and fight harder. Doses go from 10 to 30 milligrams daily, and due to its 9-hour half-life, so it works fast as users report immediate change in behavior after taking it. But it can worsen any liver conditions, cause hair loss, spikes blood pressure, but overall, it's not something most people should ever touch, and especially not women, due to its extreme androgenic effects. Superdrol. Superdrol is like an immediate strength gain package, and users report lifting new PRs at the same speed as their pre-Superdrol weights. Superdrol was made in 1959, but not used widely until 2005, when supplement companies started promoting it since it wasn't banned and people unknowingly bought the most powerful steroid as a supplement. Doses range from 10 to 30 milligrams daily, and it was banned after people started getting jaundice for using it for months. Basically, people's livers started failing. Superdrol doesn't aromatize or retain water, giving bodybuilders the grainy look, and it has 4 times the anabolic rating than testosterone, and it spikes up blood pressure so much blood vessels in the eye can pop. The liver can go into extreme failure in 3 to 4 weeks, and since muscles grow so fast, ligaments and tendons can't keep up, spiking injury risk. So while it's a powerful anabolic substance, it's not worth it at all. A few weeks of gains versus a lifetime of health issues. Anyways, like and subscribe and watch my other vids in the meantime.